First, though, Dr. Adam Fox is back for a special allergy clinic, so let's get straight to Samantha. Hi, Samantha.
Hi.
Hi there. Right, you've got an expert here, a world expert. How can he help?
My 7-year-old daughter was diagnosed 2 years ago with a cat allergy, and we've managed to manage it for the last 2 years with no problem. She's not had any issues, flare-ups. The last couple of weeks, she's been getting really bad flare-ups, big puffy eyes, blotchy face, and I can't seem to get it under control. We've been back to our GP, and he just said, keep taking antihistamines. We've now got 2 different antihistamines, and I just can't get on top of it. I'm wondering if there's something I'm missing or something else I can try to help her.
OK, so cat allergy is pretty common. I think the first thing I'm thinking about, though, from your story is if things have suddenly got worse but nothing else has changed, I just wonder whether your daughter's become allergic to something else as well. We're right in the middle of the birch pollen season, and that might be the reason that things have suddenly got worse. There's 3 ways to treat any allergy. The first is trying to avoid whatever it is that you're allergic to. Not very helpful with pollen, can't keep away from it, but with a cat, of course, that's a decision you have to have a little think about. But the other options are medication. Antihistamines are really helpful. Make sure it's the right sort, so the long-acting, non-sleepy ones. So not things like chlorphenamine or Piriton, much better things like cetirizine or loratadine. They're still over the counter. And the other option are nasal sprays, and they can be really helpful. So when the antihistamines aren't quite doing the job, and you need to step up a little bit, have a chat to your GP about a nasal spray, because it can make a real difference.
And if it is birch pollen, is there any way of being tested for it, or is it just kind of process of elimination a little bit?
You can do an allergy test, and you can do an allergy test to diagnose any environmental allergy. So likewise, the cat, just to confirm that that really is the problem. It'd be awful to find after you've got rid of the cat that it turned out that wasn't the problem. It was house dust mite, for example, which is also
How do you do an allergy test?
So 2 ways. You can get a blood test done, or you can do what's called a skin prick test, which is where you put the different things that you might be allergic to on the forearm, gentle scratch, 10 minutes later a little bump comes up, and that relates to the likelihood.
And are they quite easy to book into, or is there a massive waiting list?
Well, usually the only place where you can get a skin prick test done will be in some sort of allergy clinic. Now, there's lots more allergy clinics around than there used to be. Most district general hospitals will have one, but your GP will have to decide whether it warrants it. It may be pretty obvious to the GP what the problem is, so they can advise accordingly. But the other option we didn't touch on is desensitisation, which is a treatment to make you less allergic. And this is something that we're doing more and more of in our allergy clinics. And that can really help with bad hay fever, make you less allergic to that. And it can help with cat allergy as well.
OK, all right. Thank you so much for your call. We've got Leanne on the line now. Hi, Leanne.
Hi.
Hello. So you've got a 10-month-old son, and he's got an allergy to cow's milk protein.
Yeah, he's cow's milk protein allergy and soya as well,
OK.
which is the next alternative.
And so you're currently breastfeeding, are you?
Yep, completely breastfeeding and avoiding any kind of cow's milk protein, so nothing in my diet, which is quite difficult.
Yes, I can imagine. So you're wondering whether or not you can start weaning, and I guess what you do next, really.
Yeah, where I go next. So other 1-year-olds would then go on to cow's milk if they've been formula fed or sometimes breastfed. But where do I go with his? Because he is so allergic, and soya isn't an option for 1 year old.
OK.
OK, so cow's milk allergy affects about 1 in 100 kids. And 2 different sorts. You get the sort where you have milk and you have an immediate and obvious reaction. The other sort is when it causes more delayed chronic symptoms like diarrhoea and colic and reflux. And that's typically the one where there's also a problem with soy. I would say the best option is to carry on breastfeeding if it's at all possible. It's the best food for infants, including milk allergic infants. Sometimes the milk in mum's diet can get through and cause a bit of a problem. That's pretty uncommon. Usually it's absolutely fine. So that's the ideal. But still, I understand you'd want to add something else into the diet, particularly over the age of 1. And things like calcium-fortified oat milk or coconut milk, as long as it's got the calcium in. Because over the age of 1, what you need for milk as a baby is the calcium content. And there's now quite a range of different things that can help.
And you said earlier that milk's one of the ones that you can sort of grow out of.
Yeah,
possibly.
so typically you do. If you've got the sort of the nastier immediate type of milk allergy, may not be till 5 or 6, sometimes even older, that it goes away. The delayed type, which I'm guessing from what you've said is what you're dealing with, typically it will be outgrown by maybe 2 or 3 years of age. Even at 1, some kids have outgrown it.
So what would be the alternative, though? I mean, if it continues and continues and continues, she'll be breastfeeding when he goes to school. So what can you go to?
OK, so from 1 year of age, it's absolutely fine to have, instead of milk, to have a calcium-fortified alternative one, like oat milk.
Or coconut.
Yeah, coconut, something like that.
OK, all right.
yeah,
Thank you very much indeed for that. Hi, Lorna.
Hi there.
Hi there, right. So your son was diagnosed with a Brazil nut allergy 4 years ago when he had an anaphylactic shock from eating them. Had other types of nuts before. Nonetheless, they've been warned to keep him away from all nuts. So obviously she's thinking whether or not that's going to make the allergy worse. Is that right?
Yeah, that's right. He had the skin prick test done when he had the anaphylactic shock and came back negative for all nuts. And then he had the RAS test done and it came back positive just for Brazil nuts. Even though he was fine with all other types of nuts before, they have said that he's not to eat any sort of nut.
Okay, so
that's 4 years ago. He's now 12. And
let's see what...
they said they won't test him again.
Okay.
So it's a really interesting question that we've, as an allergy community, we've spent a lot of time thinking about, because traditionally the advice was if you're allergic to one nut, and most commonly that would be peanut, but much less commonly other tree nuts like Brazil nuts, the advice was just avoid all nuts. That seemed to be the safest thing to do. But there was actually a concern that over time, the kids that were avoiding all these other nuts that they weren't allergic to were actually developing allergy to those nuts.
Oh, right.
And there's some really interesting research looking into whether that's happening or not. But certainly my practice and specialist practice now is to get a really precise diagnosis, decide with your specialist what nut you're allergic to, and actually all the other nuts continue in your diet.
So she's kind of had that, hasn't she? If they've pinpointed it.
It
but it's
sounds
a bit
like
of a scary thing to do if you've been told not to.
But you need to sort of make sure, because especially with that story about a little bit of lack of clarity about the exact results, so make sure you get the specific personal tailored advice for it. But it could mean that he could be eating all of these different nuts that he's been avoiding. But then you need to be very careful where you do that, because of course there's a risk of cross-contamination. And my advice in this scenario is normally at home, the nuts that your doctor has told you are safe, that's where you can eat those.
Okay.
But when you're in restaurants, at school, out other places, probably not such a good idea to say anything other than just no nuts. To be super careful.
Okay.
Just a quick one here from Andrea. Says, my 11-month-old baby has eczema. I originally thought it was caused by an allergy to dairy, but it's not. So what else could it be?
So this is a really long-standing debate that was happening for years between doctors as to what is the cause of eczema. Eczema affects almost 20% of UK infants now. It's really common. And if you've got eczema, you are much more likely to get a food allergy. And the worse your eczema is, the earlier it starts, the more likely that is to happen. We now know that there's actually a gene that codes for getting eczema. So actually, it's not food allergy that causes eczema, it's actually having underlying eczema, which is genetically programmed, that predisposes you to then getting allergies.
Wow.
And those allergies can then make your eczema worse. So it's really important to consider both angles of this.
So what should she do then?
So the ideal is firstly to make sure that the eczema is well managed. You've had good advice about the use of appropriate moisturisers, anti-inflammatory creams, steroid creams, which if used appropriately are very safe. That's the mainstay of management. But then having a think with somebody that's got experience in the area about the possibility that allergies are involved. And in some kids, it's appropriate to do allergy testing even before they've eaten things like peanut, because the risk of having a peanut allergy is so much higher if you've got eczema already.
What about things like kefir and goat's milk and things like that to help your gut flora? That's what they say.
Yeah, that's right. So there's a lot of interest about the gut bacteria and the influence it has. The jury's out a little bit. There's been a lot of research about this, and after sort of 25, 30 years of it, I don't think we've got an enormous amount concrete to say yet. It seems that if you give mums, while they're pregnant, probiotics where there's a strong family history, you might reduce the risk in the child. But I think we're a long way from saying that this is going to make a big difference.
OK, brilliant. Thank you.
Thank you very much indeed.
Thank you very much.
Thank you
for your calls as well.
If you are in search of something completely different, the perfect Easter cake, then look no further. Hopefully you're not allergic to it. In